The longer a person stays sober, at least the longer I stayed sober, the less time really mattered. It's that width. Is a person in integrity? How does a person carry themselves?
Welcome to Positive Recovery MD. If you're listening, chances are you want to create happiness around you and thrive in your life. We're glad you're here and you've come to the right place. This podcast will inspire and motivate you to not merely survive your recovery journey. We'll give you the tools to build or strengthen your foundation to thrive and flourish in your life. In each episode, we will come together as a community to have authentic conversations around addiction, recovery, and what matters, growth and progress, not perfection, all while developing positive habits for you to utilize. To learn more, please visit positiverecovery.com/podcasts to sign up and to receive the daily positive interventions that we'll review, as well as gain access to exclusive Positive Recovery content available only to Positive Recovery MD listeners. All right, let's get started.
Welcome to another installment of Positive Recovery MD podcast, where we talk about recovery and thriving. And we've got a great guest today. His name is Andrew Krieger, who I'll let him tell his story. But one of the few guests that I knew before I got sober, and I knew him before he got sober. But he got sober long before I did, unfortunately. So he's got a little more wisdom than me. Welcome, Andrew.
Thank you, Dr. Powers. Yeah, that's quite an intro. I will try to be wiser than you if I can.
Tell our listeners a little bit about yourself. Like, you got sober a long time ago, yeah?
Yeah, sobered up in 1991. I was 22, and I was 4 years into college, dropping out, and had blown through a basketball scholarship and all kinds of other stuff. And really by necessity, I wound up getting into recovery, getting sober, came into this field. You and I are both in the addiction treatment field, really by a fluke. As I think you know, I have known George Joseph a long time. I know he's a friend of yours, but he's the guy that actually got me into the recovery field. And that was about 9 months after I'd gotten sober. And my qualifications were, I had time available because I was back in college. I knew George Joseph, and I was almost a year sober. And back in the late 80s and early 90s, that really was, there was a heavy paraprofessional presence in the treatment of addiction. And I guess there still is to some degree today. But back then it was pretty standard. And just wandered into this field. And quickly kind of figured out that if you were going to be a clinical guy, it really was about your education level, licensure level, that sort of thing. So finished undergrad, did a double master's at University of Houston. I started off getting a social work master's, and then wound up, because of managed care, which had really hit full force by 93, 94 in Houston. It was gutting medical and really gutting mental health. So instead of going on getting a master's, then a PhD, and then being an academic clinician, which was my original plan, I figured I better have a plan B, because I was getting ready to start a family, had gotten married after undergraduate. And so I went and did an MBA. And in 99, after working in the field really for about 8 years, left the field completely, wound up with a job offer from Compaq Computers right before HP bought them out. Then went into tech and principally executive positions after the initial entry, but a big brand, consumer electronics, software, that kind of stuff. And had a nice 13, 14-year run. Also spent 5.5 years in Los Angeles, so I was in California for work. And then wound up fluking back into the field. So Gene Degner, I know he was, I'd really in the 90s had worked principally on his treatment teams or derivatives of his treatment teams. So when George left West Oaks Hospital to really kind of come in and convert the Right Step from a sober living house to a treatment center, I was one of his first defectors. Worked there about 4.5 years in grad school. But these were derivative teams of Gene Degner's, who was one of the first boarded addiction medicine doctors in Texas.
He gave me my first shot. Like when Dr. Brown went to do his residency, I was part of contemporary medicine. I was with Leith. And
Yeah, isn't that amazing?
Yeah, I worked at your practice.
No, actually, I did know you had spent some time. I didn't know exactly when or in what capacity, but I knew you had an affiliation with Gene. Yeah. So what happened was I wrapped up a software startup and then kind of came back into the Degners, Susan, his wife, and Gene, and they had asked if I could help them transition the practice. That was about 14 years ago. So there you go. I've been back in the field up to my eyeballs since. And I guess the other noteworthy, I did a doctorate in social work, principally clinical social work at the University of Southern California, right? So, fight on, as we say, and wrapped that up in 2020 and have been working clinically and then growing. We took that practice over from Gene about 8 years ago, and Dr. Allaire, who you know, a contemporary of yours, he's our main medical doctor, addiction medicine doctor. I do a lot of the behavioral stuff. Got some real kind of old guard guys involved. A guy named Greg Drummond, who was the CEO of West Oaks Hospital, also MBA, MSW type. So we've got a private practice in Bel Air. We do a lot of hospitalist work, and then we do a lot of addiction work.
Awesome. And do you have 34 this year or 35?
35 in May, so I'm at 34.
Okay. All right. Yeah. So that's a sexy birthday, right? 35. 34 is like, 35 is good. It's a good, good solid derivative of 5. Have there been any sort of phases of your recovery? People that have the beauty of hindsight that sort of look at the phasic part or, sort of life as a pendulum in a way. Does that apply to recovery? Is there sort of like a cyclical thing that happens or a growth thing that happens, or is it just all, who knows?
I do think there's a pattern there, and I would say in my life, as well as I've had almost 25 years of direct clinical practice, more or less, and working with people who are early in recovery and then going into longer term recovery. There certainly seems to be a pattern. And again, I'm not citing any particular research, but in my mind, there's sort of a stabilization period. So early on, you're in a crisis typically. I don't know many people that got into recovery or sobriety that weren't coming out of some kind of crisis. So from there, you're somewhat building a foundation for a period of time, plus the electrical activity in your brain is sorting out, the dopamine reception in your brain is sorting out. So that's all kind of the stabilization period. I like the research out of Ohio State Medical School on post-acute withdrawal, because that really is the brain kind of coming back in phase. And I certainly think that there's a relevant period of time where you're reinforcing that foundation in recovery, plus kind of normalizing normal, learning how to deal with your feelings. A lot of that stuff early on is behavioral, and I'll flip it back to my own experience in a second. Somewhere, 18 months to 3 years, depending on the person. Then you're sort of in a sustaining, longer term phase, I would say, and that really is where the in my mind the growth, and you start dealing with heady concepts like emotional sobriety and plugging back into life and all of those good things. So in my mind, my experience was this: my brain was pretty short circuited when I got here. And so it was really focusing on simple actions. And a lot of those were kind of point and shoot and not trusting how I thought or felt. At some point, I remember my mind slowing down a little bit, my feelings not being all over the place and being somewhat emotionally regulated, and starting to have a sensation of connection with others a bit, a little relief from how I thought and felt, some hope, some happiness, that kind of stuff. And then it became very compelling. It was less about moving away from whatever that crisis was and more moving into something that was self-reinforcing. So I really do believe that. And then anybody who's been sober a long time are going to have many phases in their life, and I'm certainly no exception. Just let's call it normal adult life at that point.
So yeah, that's awesome. And I think that's consistent with what I've experienced in 22, 23 years, coming on 23 years. But so you said two things that I'm not sure that can be unpacked rather. So the first one is post-acute withdrawal syndrome. What is that? That research you cited out of Ohio, it kind of like just describe that in your words.
Yeah, absolutely. So you have acute withdrawal, which is the physical detox and withdrawal symptoms from substances, alcohol, opiates, cocaine, any addictive substance.
Yeah.
Post-acute withdrawal is really the dopamine reception, blood flow, and electrical activity normalizing in the human brain. And the brain has been pounded, and the dopamine receptors have been supercharged with psychoactive drugs, right? So it takes some time for that to sort of level off. And what's interesting about post-acute withdrawal is it mimics a lot of symptoms that you would see in other mental health issues, right? So
Yeah.
hypersomnia, insomnia, depression, anxiety, etc. I think there's a real misconception that everybody who has a substance use disorder has some kind of mental health issues that are co-occurring.
Right.
As you well know in your practice, I've certainly seen in mine, plenty of dual diagnosis cases, as we call it. You'll see pre-existing, you'll see people get into a recovery process and they're still, let's say, have a bipolar condition or clinical depression or clinical anxiety. I would say what is far more common is that where you could throw the entire DSM-5 at maybe half the patients you meet with, if somebody gets into a good recovery process, the majority of people that I've seen or have worked with clinically, that sort of sorts out. And it's not that medications like antidepressants or other mood stabilizing kinds of medications aren't helpful, as long as they're not contraindicated, right? So non-addictive. It's that there's a big difference between a person who has that co-occurring disorder and somebody who is primary, substance use disorder and has all of these kind of secondary symptoms. And I mean, it's uncanny how most people who get sober or work in this field or have experienced somebody who's, let's say, 9 months to a couple of years sober, wow, it's a totally different person, right? Like they seem calm, they seem leveled off. So what's happening is, if you look at that research, and I'm just kind of going off the top of my head, it was a study out of Ohio State Medical School, and I wish I could give you the exact citation, but I came across it probably about 10 or 11 years ago, and it really summarized it well. There was a lot of talk about what that was, but I believe it was typical symptom onset was about 2 weeks after last use, and then peak symptoms about 2 months. And then, could go. I've seen it in my practice as long as 9 months to a year. Those are pretty extreme cases.
Right.
Usually benzodiazepine withdrawal, that real nasty, dirty substance, so to speak. But again, if you think of like the brain scans that Daniel Amen does, right, especially the addiction ones, well, you look at that electrical activity in the brain, and it looks like somebody fried the circuit board, and then you catch that same brain a year later. And all of a sudden, it just looked like a normal neural network of electrical activity, right? And I think that there's some wisdom maybe in the 12-step rooms as well, as with clinicians. So I think this is why a lot of those early interventions need to be behavioral, right?
Yeah, I'm with you.
Brain is hijacked. Brain is not firing on all pistons. Brain is back solving to a very profound and compulsive impulse that's basically saying, give me chemicals to not think and feel.
Yeah, I actually just saw somebody who is in that phase of a post-acute withdrawal. I'm obviously not going to use the name, but so his last use was about 3 weeks ago, and he started out not feeling like in the acute detox, didn't think that he could possibly live without opioids. We learn that we need them because we take them, and then when we feel discomfort, we take them again, and we don't like how we feel without them. Then, wrestling with the bear, explaining look, give abstinence a shot, and boom, feeling great, feeling on top of the world because of the freedom, not like manic, but there's that relief. Then just today, boom, feeling irritable, hands are clammy, all the withdrawal symptoms like you experience acutely can hit. And the person was completely hysterical, saying, I can't do this. And sure enough, wrestling with the bear again, letting him know, hold on, this is not going to last forever. you had 2 good weeks. And the thing is, like, so many people throw their hands up and give up. And I'm not saying things like buprenorphine and methadone aren't helpful. They definitely are. The research is very clear. But the pendulum has swung so far in the direction of, oh, you have an opiate addict patient, they must be on buprenorphine. I'm like, I was an opiate, I was on everything but roller skates. But like, thank God I didn't come through a program that thought every single person had to be treated the exact same way. I wouldn't be abstinent. So that phenomenon of post-acute withdrawal, like it's hard, and I get how frustrating it is. And if you're listening and you have it, if you feel good for a period of time, you're going to feel that way again. It's going to change. Things change. It's just, anyway, yeah. So the second thing you said was emotional sobriety. I know it's near and dear to your heart. That is what? Define that.
So in the classic sense, I guess you could kind of break it down into 3 major buckets. And we could spend a heck of a lot of time talking about where that phrase came from and the different nuances of it. But effectively, the first has to do with emotional regulation, right? Most people who have been using chemicals as their primary coping mechanism and who are actually hyper feelers, that's a bit of I think a surprise to people that don't understand addictive disorders, principally because people in active addictions do things that almost look sociopathic, right? But think about it logically, it sort of makes sense. What kind of person or what kind of wiring necessitates that you numb out how you think and feel? And indeed, all addictive substances are an emotional buffer to the world, right? So you take that coping mechanism away, somebody's not used to dealing with feelings, and all of a sudden, they're all over the place, right? So emotional dysregulation, I think, is pretty common with people in early recovery and some people later recovery. And self-awareness, being able to dial into the present, it sounds like a pretty heady concept. All right, but think about it. There's often a degeneration in functioning with addictive disorders. I sometimes joke that one of my first tasks was basic hygiene, right? And I wasn't raised in a barn, right?
Right, me too.
But being able to actually have some sort of connection to others and self-awareness, and then again tied to emotional regulation, you're talking about healthy coping skills, right? And there are lots of unhealthy or maladaptive coping mechanisms that not just alcoholics and addicts develop, but people develop.
Cognitive distortions. There's a name for them. Yeah.
Yeah. There you go. Right. Right out of the CBT handbook. And but here's the thing. If you want to put it in a 12-step context, emotional sobriety, best of my knowledge, is only written about in one place in the core AA literature, at least. That's the Alcoholics Anonymous Blue Book, and then the
12 and 12.
12 Steps, 12 Traditions. Yeah. In the 12 and 12, in the 12th step, I believe it refers specifically to emotional sobriety really early on, like first, second paragraph. And it's in the context of that spiritual awakening after working the steps,
Right.
It's interesting because there's a lot about feelings and dealing with negative feelings, getting back into kind of a normal range of human relationships, emotions, that kind of stuff. But when we're looking at the 12th step, having had a quote unquote spiritual awakening, which I certainly view on that sort of vector, but also see it very much as a psychological thing. If you look at what Carl Jung meant when he was originally, writing about that, and he had a very famous case, Roland H.
Yeah.
It was one of the members of the original Oxford group. And I remember studying that, and this is way oversimplification, but my interpretation of Carl Jung's view is it's basically a profound shift in how a person thinks, feels, and acts, right? And so going from a very, escape-oriented, emotionally dysregulated, hypersensitive, emotionally reactive state, let's say as a default, or just numbed out, tuned out, into dialed in, connected, an ability to emotionally regulate, an ability to function. I guess if we were going to look at, Maslow, would be moving towards self-actualization on some level. And indeed, people with really not just, and it's funny, you talked about length of sobriety and discounted your like 20 plus years, which is somewhat hilarious. The longer a person stays sober, at least the longer I stayed sober, the less time really matters, right?
Yes. Yeah.
It's that width. It's is a person in integrity? How does a person carry themselves? Are they plugged back into life? Are they still working on themselves? I've known plenty of people with double digit sobriety, long term sobriety, and I don't know. I don't know if I would trust them to walk my dog. They just seem a little all over the place. And I've certainly seen people with a lot less time, 3, 4, 5 years, and they are just on point, on fire.
Yeah. Yeah.
Lighting it up. And they had that kind of glow to them, right? So anyway, I don't think length of abstinence gives us much of anything other than maybe a little bit of wisdom and some perspective.
Right. No, I have a funny story about my emotional dysregulation. And it was like in my first year, I was back to practicing. I was working at your practice with Gene and Mike and at the park. When I got sober, I did the right thing and I turned myself in. I self-reported to the Texas State Board of Medical Examiners and they had me on a private order. And so I had to call every day to see if it was a certain color. And if it was, I'd have to go, do a drug screen.
Yeah.
So one time I went there and it was in the middle of the workday, or at least in the beginning of the workday. And I had all these patients that were just waiting to be seen. And I couldn't go to the bathroom because I didn't really understand the timing. And so that was in the back of my brain. So then every other day I was like chugging. So I get called. I go, but I had drank about 2 liters or gallons or whatever. I'm not great with volume, but like a ton of Kool-Aid or whatever the red punch is. And boom, get the results back. And it was dilute. So, this is how the Texas State Board, this is a state of Texas operates, like shoot first, ask questions later. So because it was dilute, they assumed it was positive and I had to increase the frequency. So I went to a higher color. I was getting punished. And one would think that one would, or I wouldn't have this reaction, but my reaction to getting in trouble on a drug screen, and I didn't relapse, but was to relapse. My emotions were so overwhelming. Like I didn't know what to do with myself. And I was thinking like, oh my God, I got to use. And that was absurd because I didn't actually want to.
Yeah.
That talk about emotional dysregulation, man. Thank God the behavior part didn't kick in. Yeah.
Well, no doubt. And that I like that term delusional, that delusional thinking. We used to call it denial, but not a great term, from the old 80s, 90s treatment centers. I like delusional thinking and it's back solving to that feeling or that impulse. And to the outside observer, it sounds nuts, right? Like who would go, well, gee, you're
right
on a 5-year monitor with the medical board after self-reporting, and you have somehow logicked yourself into a box that says, well, using makes sense, which is insane, right?
Yeah.
But if you understand the way the brain works and you understand addiction, it makes perfect sense. And if you were to share that with somebody in recovery, with a clinician like yourself or like me who understands it, we go, oh yeah, of course you're thinking like that, right? And you don't have to act on it. And there is something about that support system. You and I had spoken about George Valiant's framework for sustained remission, and I thought that was super cool that you almost had a shot at having him be your mentor. He's been one of my intellectual just idols for decades. But that idea of close supportive relationships, why is that so important? Well, to reattach for attachment, but also for perspective, for somebody to go, hey man, it's fine, take it down, right? The other 3, of course, being substitute behaviors, external accountability, and then a deeper connection with things outside of yourself, spiritual or in my mind, otherwise.
Yeah.
But again, those things sort of check this wiring. And as you well know, I mean, you're an author, a medical doctor, presumably have done plenty of academic research as I have. At the end of the day, this is a brain wiring thing, right? I mean, it is quite literally an altered midbrain, AMA, APA, NIH, brain disease,
Right.
highly stigmatized, often misunderstood, often misdiagnosed and left untreated. And what you find is once you sort of accept that, oh, there's something in my brain functioning that has this dopamine reception default setting that intellectually in the frontal lobe back solves to a very primitive impulse, up there with hunger, thirst, survival, sex. Yeah. I mean, all midbrain stuff, right? That it's like, wait, if I just live my life by a few simple rules, then effectively what a person has, as you're an example of, as I believe I'm an example of, it's a life unencumbered by the physical, mental, emotional, could argue psychological or spiritual aspects of an addictive disorder. And I think that is the whole shooting match in my mind. Once you're past that, okay, don't drink or do drugs, do these things, get yourself, kind of back on the rails. But then it's about plugging back into life and having a life that's worth being sober for, in, and maybe putting something back into this world,
Yeah, and I like how the Greeks talk about eudaimonia and sort of like, humans pursue happiness for its own sake. Everything else is kind of for that. There's higher pleasures and lower pleasures. And I know it's a gross oversimplification, but the way I see how with gaming and social media and porn addiction and all these and drug addiction and all these things, I see that as like a lower pleasure, like just hitting the dopamine bell, bing, bing, bing. And then emotional recovery, the complexity of human relationships and the development of coping skills and all the things that encompass emotional, sobriety are the higher pleasures. You talk about sort of the transformative experience of opera.
Yeah.
And
Yeah.
I get it. I mean, I do too. I get that with the symphony sometimes. And yeah, it's definitely not just the same pleasure that we get when we're like eating great ice cream or having sex or whatever it is. Experiencing it, I would say that it almost is the difference between the cortex and the mesencephalon, the lower brain, the higher brain.
Look, I think it's important to note there's a time to have sex on ice cream. Okay, there really is. like nothing wrong with that.
No, absolutely not. You're right. I do not mean to imply, Your Honor. I did not mean to imply.
But if that hijacks the rest of your life and puts it out of balance, that's not much of a life. And I do think it's funny how it manifests. I know some very good friends that have great sobriety, and they're zen sitting in a hunting blind, freezing their butts off, during that part of the year, with a high-powered rifle. Right? I think it can be different things to different people. It's funny you bring up opera. My history with opera is that was sort of our football growing up. My father was on the opera board, and we had season tickets to Houston Grand Opera in my family many, many years. It's a very acquired taste, but if you grow up in it, right, which like cycle of victimization, I dragged all of my children to go see opera when they were younger. But I think any of the arts, when there are these transcendent moments, there really are, and it's really about tapping into emotion and the human experience and connection. Yeah, I think too there's something from that sort of primitive, I'm doing this to no longer be in trouble, or I'm doing this because I don't want to feel that way, or I'm doing this to not blow up my life. I mean, those are great motives early on.
Avoidance goals versus approach goals.
Yep.
Yeah.
And at some point, the problem with that is if you stay in that, you're going to wake up in a life that's not in crisis, and you're going to forget.
Yeah.
That most people, when they stop the drugs and alcohol and they start doing some healthy stuff, that most people I've seen, their life normalizes relatively quickly, unless they were severely reduced. But the shift becomes, you're trying to grow towards an ideal. You're trying to grow towards it's not that you don't get something out of it. I think doing the right thing and trying to grow along those ideals has a huge amount of satisfaction and a huge amount of connection and a huge kind of reward to it in and of itself. You think of the wisdom of like the St. Francis prayer. I'm not Catholic, but I love that prayer. I think it's a perfect meditation. This idea of, how do I love instead of be loved, or how do I understand instead of being understood?
Being understood, right.
Yeah, that kind of stuff. How do I put something in instead of take? To me, what happens is it's like growing towards, like you were saying, this ideal. And the reward of living a good life is having a good life, right? But it's to me about being present. It's about being comfortable in my own skin. It's about being comfortable with how other people are, for the most part. I mean, humanly, imperfectly.
Right.
But over time, I guess a good way in my mind that I think about it, I remember very distinctly somewhere in the first 6 months of getting sober, the first time by myself, I just felt okay. And it actually surprised me. I didn't quite realize it, but I was on a college campus, and I was there between classes instead of going home and running around doing stuff. I think I just went and read in the quad or something. But I had been there, say, 4 or 5 hours. And then as I was walking back to my car and got to my car, it hit me. I had just been sitting around by myself, and it felt perfectly fine. And it was an overwhelming experience because I could not remember. I'm sure there were times as a child I had felt that, but I could not remember feeling like that abstinent really ever, And it was
I got goosebumps. I know exactly what that feels like.
Well, here's what kind of blows my mind. It almost inverts, right? Like the times I don't feel okay are so rare,
right,
that they stand out like a sore thumb. And okay, what created that? I think simple action over time, but I think that's that state where it's like, it's not that you transcend the human experience. It's that feeling off base is so rare. And when that does happen, typically there's almost like a reflex, in my experience, to pivot towards, let's say, leaning into it and addressing it because it's uncomfortable.
Right. Yeah, the inclination a lot is to avoid the discomfort early on, right? Like that's just sort of natural because the coping skill set isn't there, and we basically, like you mentioned, use to escape the interface with life. But I've learned, and you sound like you agreed, like when things don't go right, as they frequently do in life, that leaning into it is the coping skill. It doesn't, not avoiding it. Like it sucks.
Yeah, life is not fair.
Exactly.
People don't act right.
I am kind of a meathead and a Looney Tunes fan. And because of that, I want to see The Barber of Seville. I believe that's an opera because
it's on Houston Grand Opera this year. It's, I think, the last opera of the year. The Barber of Seville.
Well, if one of your kids drops out, I'll definitely
be careful what you ask for. I'll take you up on it.
Do they show Bugs Bunny making Elmer Fudd's?
No Bugs Bunny. It's one of the classics. But it does, a lot of Mel Blanc, who voiced all of the Looney Tunes. He had a shockingly good voice and range, and a lot of the things they were parodying. If you go to an opera, you're like, oh my gosh, that's from that Bugs Bunny.
Yeah, exactly. Well, Andrew, thank you so much. It was enlightening. You're very interesting, and I know I won't be the only one who says so. But yep, I just end by saying, remember, this is not a dress rehearsal. So be good to yourself, be good to each other, make it count.
Yeah, thank you so much. It was a real privilege to speak with you. Would love to do it again sometime, and I appreciate the opportunity.
Thank you for listening to this episode of Positive Recovery MD. Don't forget to visit positiverecovery.com/podcast to sign up to get your daily positive interventions sent straight to your inbox. Be sure to subscribe to Positive Recovery MD on Apple Podcasts or wherever you listen to your podcasts to receive an automatic download when a new episode drops. And as always, if you or someone you know needs help, visit positiverecovery.com or call 877-4-SOBRIETY. That's 877-476-2743. Our why is simple. We care. We are here to help.